I have is due to the piles or hemorrhoids that I have.
Is rectal bleeding one of the classic symptoms?
Most classic symptoms, yes, of rectal cancers, and it is overlooked by so many patients. They end up presenting with firm, large rectal masses late, often within, with lymph node involvement, almost stage 3 and stage 4 disease, because it was just assumed it was hemorrhoids. So if you have anything more than a 2-week history of change in bowel habits, and that's what I would use the term, change in bowel habits, because remember, what you regard as constipation might not be regarded the same for me. So if you have noticed you've started to be different, please go and see your GP. You can do blood tests, you can do endoscopies, colonoscopies. There are so many ways to get to know what is going on within you.
Is there a specific age profile that determines one's risk for colorectal cancer?
It's usually over the age of 50, but you can get it in much younger age group with those that have hereditary syndromes. So strong familial history, other disorders like hereditary polyposis coli. So you must have an awareness also what's happening in your family. What did your grandparents have? Your parents have? Do your siblings have any malignancies? So these are all important things to know, which is why I like the idea of your wife giving you permission to speak about her experience, because it gives her siblings and your children and everybody else the opportunity to know this information, to share one day, because your doctor will ask you this: is there anybody else in your family that has had a cancer?
And family history is important.
Yes, and often I get the answer, I'm not so sure, nobody told me anything. So sometimes to keep a diagnosis private is actually depriving other family members of the chance to go and screen, or prompting them to screen, rather.
My studio guest tonight is the brilliant clinic